Welcome everyone. Thank you very much for taking time from your day to join us for this webinar and for your efforts to join us next week for Advocacy Day. We're really very excited. We have a great group, close to 100 people joining us next week in Washington, D.C. For this very important activity, and we're pleased that all of you could participate. My name is Janet Heischetter, and I serve as the Executive Director for the DMRF, and I also serve on the Steering Committee for the Dystonia Advocacy Network, or the DAN. Our objective for this webinar this afternoon is to help you learn what to expect next week. We're not going to get into any of the legislative issues, as we'll cover those completely on Tuesday afternoon, but we really want to just help you prepare for how you can best prepare for a successful outing in Washington. Before we get started, allow me just to make a few announcements about the webinar. The audio for today's webinar is available via telephone or through your computer speakers. Due to the large number of participants, everyone except for the speakers will have their lines automatically muted in order to keep the background noise to a minimum. If you are using your phone, please make sure that the phone call button in the audio pane of your attendee control panel is selected. You will also need to enter the audio pin that's shown in the audio pane, and please turn your computer volume off. If you're listening via your computer speakers, please make sure to select the computer audio button in the audio pane of your attendee control panel. Your questions are important. Please write them in the questions pane on the screen as you think of them, so you don't forget them, and we'll do our best to get to all of them today. If we are not able to get to everybody's questions, we have plenty of time on Tuesday to make sure that we cover everybody's questions. We want you to be as comfortable as possible when you hit the hill on Wednesday morning. Should you have any difficulties during the webinar, please feel free to email Jody Roosevelt. Her email address is listed there, jroosevelt@dystonia-foundation.org, or you can also call her at 312-755-0198 and ask for Jody, and she will do her best to help you with whatever the problem might be. And I want to thank Jody for all of her assistance in setting up today's webinar. So now on to our program. There we go. So I'm pleased to be joined today by Phil Googlis of the Health and Medicine Council of Washington. Phil has been at HMCW for nearly 5 years and came to that position with legislative experience, having served as an executive assistant in the House. He's an alum of the University of Maryland, College Park, where his focus was on policy and government studies. Phil has been very hard at work these last weeks managing the development of our meeting schedule next week and the packet of material that was emailed out to everybody. So I want to give a shout out to Phil for all of the work that he's done up till now, for his time today with the webinar, and for his work throughout the year in supporting the dystonia community. So thank you, Phil. So this is our agenda for today. We're looking at, as I mentioned earlier, to provide you with an overview of sort of what to expect, what the DAN is, what this thing, Advocacy Day, is. We want to give you an idea of what to expect as a dystonia advocate, provide some advice on how best to prepare, tips for a successful day, a quick overview of what will happen on Tuesday and Wednesday of next week, and then give you information on what the briefing is, and then as importantly as all of this information, address your questions. So let me begin by just thanking you for registering, for being a part of this program, and for your advocacy. Sharing your personal story is a really big deal. You know, meeting with somebody you've never met before and sharing the intimate details of your dystonia experience, your health story, if you will, is really huge, and we very much appreciate your willingness to do it. As Phil will comment on, I'm sure, legislators and their staff remember the stories. They remember your story. That's what helps to make the difference. That's the lasting sort of takeaway in many cases from these meetings. And your willingness to share your story, you're helping us to create new opportunities for research to be funded, helping us to meet the needs of this community. You're also representing all of those who are not able to travel to Washington, D.C. to participate. You're creating critical awareness of what dystonia is and how it changes lives. And we can't thank you enough for your advocacy. So thank you. The Dystonia Advocacy Network, or the DAN, is a collaborative effort of 4 dystonia patient groups: the Benign Essential Blepharospasm Research Foundation, or BEBRF, the Dystonia Medical Research Foundation, or DMRF, the National Spasmodic Dysphonia Association, or NSDA, and the National Spasmodic Torticollis Association, or NSTA. We've been working together now collaboratively for over 10 years, and members of Congress and their staff very much appreciate the fact that these organizations have come together to put the needs of those affected by any form of dystonia before all else. It sends a strong message that we've been able to collaborate and work together for over a decade. The DAN has a steering committee, representatives of each of those organizations, that works closely with Phil and the other team members at HMCW in developing our legislative agenda and through all of our legislative and advocacy efforts throughout the year. Advocacy Day is our program that happens annually, where we go to Washington to help members of Congress, as I mentioned earlier, understand what dystonia is and how it changes lives, and how they can help us and how we might be able to help them. Our advocacy is year-round. Following participation in Advocacy Day, you may receive email alerts in the coming months asking you to contact the offices you may have met with on specific issues, and so that they can better understand how that issue might affect the dystonia community. So HMCW is the Health and Medicine Council of Washington. It is a highly regarded legislative consulting organization that the DMRF has worked with now for nearly 25 years. And the Dystonia Advocacy Network has worked with since its inception for over 10. We are grateful to both Dale Dirks, pictured here on the left, who's the president of HMCW, and to Phil Googlis for all of their hard work and their great guidance, not only in helping prepare us for Advocacy Day, but as mentioned throughout the year for all of our advocacy activities. And I am now going to turn it over to Phil.
Thank you, Janet, and good afternoon to everybody who has joined us today. Thank you for taking the time to be with us and to learn a little more about what we will be doing next week. I first would like to thank Janet for all of her work. She is a great partner for me in preparing everything for our Hill Day in terms of helping to get all of our materials prepared, and is really a great partner with me to make sure that our day goes off without a hitch and we're able to accomplish as much as we do. And as Janet mentioned, with advocacy being more than just one day, but truly being 365 days a year, she's a great partner year-round when it comes to advancing the dystonia portfolio here on Capitol Hill, so I thank her. First, I just want to go through what is Advocacy Day. For those of you who haven't been here before, I look forward to you being here the first time. Those of you who have been here before, I look forward to seeing you again. What Advocacy Day is, it's a day where we are here in Washington talking to our federal legislators about how they can be helpful to the dystonia community, educating them about what is dystonia and making sure that they are champions of the community. So we come here to Washington from all across different DAN organizations. We share, you guys will share your stories with members of Congress and their staff, and you ask them to please support our priorities. It means a lot to these offices that, you get on a plane, get on a train, or drive down from your hometown to be here in Washington to meet with them. Again, as Janet mentioned, advocacy is a year-round activity. We are very active when it comes to different things happening on the Hill. We were incredibly active, as an example, in the beginning of 2017, when there was a discussion about repealing and replacing the Affordable Care Act. The community was very mobilized in making sure that policymakers knew about the importance of patient protections and making sure that anything that was proposed with the patient in mind. So we do activate our folks throughout the year. If there's something that pops up here on Capitol Hill that's important to the community, we mobilize folks and make sure that everybody's involved. We encourage local visits for everybody to connect with their members at home. It's a great compliment for those of you who come meet with your members here in Washington to meet with them or their staffs back home and make sure that they connect the dots on why it's important they become a champion for the dystonia community. So moving on to what to expect. I know that it can seem like a lot in the beginning. That's why we try to give as much information as we can ahead of time. And what we want to do today is just go through what everybody should expect, so that way everybody feels comfortable going in to meetings on Wednesday. Yesterday, you should have received the prep packet, which outlines materials for our meetings. It gives some background information about what our legislative agenda is. It gives the agenda for the day on the 26th, the different presentations where more information will be covered. It gives information for what to expect on Wednesday and how the meetings will go, going to the Senate in the morning, crossing over to the House in the afternoon. And it gives you a breakdown on each issue that we're talking about, to give you some background on it. Everybody who will be here in Washington will be part of a team. Janet and I were just going over our schedule for next week. So everybody will be broken down into a team based on your home state. You'll be grouped with other advocates from the DAN for the day to make different meetings. So it's good that everybody will be able to interact and work with other advocates to get their message across. You will have, excuse me, you will have a set of business cards that are from the DAN. It's just easier when you walk into an office and say, hi, we're here to meet with Bob Smith. We're the folks from the Dystonia Advocacy Network. Your business cards are there with your information, and it's a good way for the staffers to have a contact for you. You will get on Tuesday the 26th a copy of your schedule, which has a breakdown of the time, who you're meeting with, on behalf of which member, what the office location is, and what the phone number is for the office, as well as some pertinent information if they're on a relevant committee or if they are a dystonia champion. Members such as Jan Schakowsky from Illinois or Chris Smith from New Jersey will have an indication on their on your schedule that they are big-time dystonia champions and lead our annual letter. That way, when you go into these offices, you know who has been supportive of us in the past, and you can thank them for that. Each team will have a team captain who I will work closely with. I will ask for their cell phone number. That way, if anything changes throughout the day, I'm able to get in touch with them, or if an issue arises, you guys will be able to get in touch with me. Each participant will get a folder with all of the information. You will have another copy of the prep packet. You will have your schedule. You will have all of the information that the congressional offices will be getting. That way, you know what information they will be getting, and you can reference it as well. In addition to that, the team captain will be having what we call leave behind folders, which is a packet full of information that you will give to the staffer as you're meeting with him and her, and it's information that they can have and keep with them, so that way when they go back to review their notes after the meeting, they can look and have some of the specific asks that we are asking for. With that, we'll talk more about this on Tuesday, but because there's the information folder that will be left with them, we don't want you guys to get hung up on memorizing specific numbers or memorizing specific asks. the biggest thing is going to be to tell your story, and we'll get into that in a little bit as well. So you will have to go through security to get into the Senate buildings as well as the House buildings. We will cover some of the other issues that arise with going through security. Janet will touch on if you have had DBS, or if you have any other medical condition that prevents you from going through the metal detector. We work with that as well. You won't have to take your shoes off as in the airport, but you will have to remove your cell phones, your wallet, any metal you have, and pass through security. It's going to be a Wednesday on Capitol Hill in March, so it's a very busy time here in Washington. You're going to see a lot of different folks from a lot of different organizations who will be here on the Hill doing the same thing that we're doing, advocating for their communities. So I also encourage everybody to pack your patience, and we'll see on Tuesday night when you get a copy of your schedule what time your first meeting is, and we can guide you to let you know what's the best time to leave the hotel. That way you can get to the Senate offices with enough time to not be rushed through security. Some people in these offices will be more receptive because we are talking about healthcare, but as I mentioned, with having two champions such as Congresswoman Jan Schakowsky, who is very liberal, and Congressman Chris Smith, who's very conservative, they're both big-time champions of our community. Our asks are nonpartisan asks. We aren't, and again, I don't want to get into the issues to confuse everybody, but we'll touch on this on Tuesday. But the important thing is, Dystonia doesn't care if you're a Republican or a Democrat, if you're from New York or Alabama. Dystonia is a nonpartisan issue, so we want to make sure that offices know that. But I want you guys to be aware too, in case you get some resistance from offices, that some will sit there and will talk to you for 20 minutes and have a lot of questions. Some will look at you, not write anything down, take the folder, say thank you, and that'll be the end of that. But those are all still important discussions to have, because it is important that these offices have our information. One of the biggest things for the day is also going to be flexibility. A lot of things may be in flux and may change. When we get our schedules on Tuesday, you may see some meetings that say TBD or have an asterisk next to them. That's because they either haven't been confirmed yet, or there may be some changes with it. Again, we've had examples where you're scheduled to meet with Bob, but at the last minute, the senator has pulled Bob away, and now you're going to meet with Jim. So flexibility is very important on Wednesday, and that's why we provide you with the office location and the office number. In case you're running a little late from one meeting to another, the team captain can reach out to that office and say, hi, we're the group from Maryland, Senator Van Hollen, we're on our way to your office now. We're just going to be a minute or two late. So that way you're able to communicate that with them. For those of you who haven't been here before, you may have meetings in a conference room. You may have meetings in the entryway to the office. You may even have meetings out in the hallway. It all depends on the amount of space each office has. So again, just be ready to think on your feet and be flexible in terms of what is going on. Most importantly, your story. Your story is critical to why you are here in Washington. This is the most important thing for you to share with offices. Again, it isn't going to be to get into the specifics of the ask. It's going to be to tell them what is your Dystonia story. We ask that everybody keep it simple and concise. We think it'll be helpful for folks to write it down, and that way you're able to keep it to about 3 to 4 minutes. When you go into these offices, you can anticipate to have about 15 to 20 minutes to have the meeting. Oftentimes, you will have to get to your next appointment, so you won't have a half hour or 45 minutes. And oftentimes, staffers don't have that amount of time to sit through a meeting as well. So keep it short, simple, sweet, to the point. We think it's very helpful for you to write it down. Keep it to about 3 or 4 minutes. Practice it. We're more than happy when I see everybody on Tuesday. If you have a question on how you should formulate your story, I'm happy to go over that with you. but I highly encourage everybody to write your story down over the weekend. Take some time to think, what do you want your members to know? What do you want the office to know about your dystonia story? And again, practice that so you're comfortable with it. In preparing your story, many of you may ask, how exactly should you go about it? Definitely review the materials that were sent to you yesterday. Look at what we're asking for. We're asking for research and more investment into that. So make notes in your prep packet if something doesn't make sense to you. If you want further clarification on something, jot that down, bring that with you when you come, and we can go over that. Again, preparing your dystonia story. How has dystonia changed your life? If you're a patient, how has dystonia personally changed your life? If you're a caregiver, how has dystonia changed your life, and what is your role as a caregiver? Give the story from your point of view. What is it like to be a parent or a loved one of a dystonia patient? If you are a patient, how has your life changed since you were diagnosed with dystonia? And again, write it down, keep it short, and practice it. Go in front of your mirror and look at yourself and go through your story. You'll be surprised how fast 3 to 4 minutes go when you're sharing your experience. So with that, I'm going to turn it back to Janet briefly before I come back in.
Great. Thanks, Phil. So we've been able now to benefit from 10 plus years of doing Advocacy Day, and are thankful to the many advocates who have shared bits of advice that they have found helpful over the years to help all of you have a successful day next week. So whether you're brand new to this or a seasoned advocate who just wants a reminder, we offer the following tips. And I will say that when we sent out the notice on this webinar, we also sent along 2 documents that were attached. One was on called 2019 Dystonia Advocacy Day Information, and the other was called Advocacy Day What to Expect. And I would encourage you, if you've not yet had a chance, just to read through those 2 documents. Again, they're intended just to help you get comfortable, to know what to expect, how the schedule goes, essentially to reinforce a lot of what we're covering today in the webinar. So first off, wear comfortable shoes. The halls of Congress they're incredibly tough to walk on. And as Phil said, every effort has been made to group meetings together so that the Senate meetings are in the morning and the House meetings are in the afternoon, to help you from having to go across the Capitol. If you're familiar with the House buildings are on one side and the Senate buildings are mostly on the other side, and we've tried to reduce the amount of walking, but there still is a lot of walking. So wearing comfortable, supportive shoes is really important to you being a happy advocate next week. We appreciate the many questions that we've received from a number of you about what the dress code is for Advocacy Day. We ask that you be business casual to business, and that jeans and shorts and those kinds of things not be worn. We understand and appreciate that for people, say, with cervical dystonia, wearing a tie might not be comfortable, but a button-down shirt with a sport jacket is perfect. We just want to send a message of respect to those we're meeting with, respect for their time, for the work they do, by dressing appropriately. So if you have specific questions, I'm happy to respond to them, but I think everyone gets a sense of sort of what the dress code is now. So Phil talked a little bit about the Dan business cards that we'll give you next week on Tuesday. One advocate 1 year brought address labels, those sticker labels that sometimes you get in the mail with a solicitation, or maybe you have your own printed out. We encourage you to bring those, and you can just put them right on the back of the business cards. It just makes it so much easier. This next one is really, really critical. If you've had DBS, if you've had deep brain stimulation surgery, please remember to bring your medical ID card. You will go through security, as Phil said, in the entrance to all of these buildings. It's just like going through the airport. So you should not be going through a metal detector or be wanded. And the medical ID card will let the Capitol Police at the entrance you're utilizing to get into the building know that you can't go through or be wanded, and you'll have to be patted down. Now, if you're a female and you've had DBS, you may have to wait for a female officer to come to your location to pat you down. And sometimes that can be anywhere between just a few minutes to upwards to 10 to 15 minutes. It just really depends. If you're running late, or if you think you're going to be late for a meeting while you're waiting, please do not risk your health by going through the metal detector or allowing them to wand you. The rest of the team can go ahead and you'll catch up with them. Your health is the utmost concern here. So a number of you have let us know that you'll be using wheelchairs. And so in the packet of materials that was emailed to you yesterday, and we'll cover this again on Tuesday, the wheelchair accessible entrances to the buildings have been noted on the map. And we encourage you to use those because it'll just make things much more convenient and easier for you. If you have other special needs, please let us know in advance, and we'll work with you to make sure that those needs are met. We want to make sure that you are fueled up, so we encourage you to eat breakfast in the morning, and we'll cover the schedule in a little bit. There are places for lunch, and they're noted in the packet of materials sent to you yesterday. We encourage you to have lunch and just stay hydrated through the day because, as noted earlier, it's a lot of walking. And you get a little nervous, and that sort of can wear on you as well. But after your first meeting, you'll be a pro. If you get lost or if you have any questions, ask people. I think you'll find that most folks are really friendly. Capitol Police are really terrific about answering questions. As Phil said, in March on a Wednesday, the Capitol will be very busy. And we will review this again on Tuesday, but we want to, again, just allow us enough time to get from place to place so that you're not rushed and feeling stressed. We encourage you to take photos of your team, take photos of the people you're meeting with, whether it's a member of Congress or the staff person you're meeting with. You may see members of Congress in the hallway. You may see them in the cafeteria. It's fun to take these pictures. Local papers love to have photos, and members of Congress love to have their picture in the local newspapers. I think lastly, enjoy the day. It's a wonderful experience working with the community to advocate on behalf of those who are not able to be there, develop new friendships. It's a lot of work. It's exhausting, but it's exhilarating. And we want you to have fun. We want you to enjoy the day, but it's also serious, and our job is to help prepare you. And hopefully this webinar has been helpful, and Tuesday reviewing all of the contents of the packets and how meetings will go will also be helpful for you. So I'm going to turn it over to Phil to talk about the legislative briefing that we do at the end of the day. Phil?
Thanks, Janet. And at the end of the day, you'll see on your schedules that we have a debriefing in the Dunkin' Donuts, which is in the basement of the Longworth building. This is an opportunity for us to come together. We'll have great discussions and conversations on Tuesday afternoon, leading into dinner. Last-minute questions will be answered Wednesday morning. And then, like proud Papa Bear, I send you all out onto the hill to meet with different offices. At the end of the day, we like to come together and get feedback from you guys. What was your day like? What were your conversations with offices? Did one office have a particular interest in doing more for dystonia? Did one office offer a suggestion that might be helpful to us in future advocacy? Was there something that a staff member asked you that you didn't really know the answer to, but you jotted it down, and now you you give that information to me, and I'll follow up with that office. In everybody's prep packet, you'll have what we call feedback forms, where it's a simple form that asks you to just fill it out in terms of who you met with, you know, the logistics of the meeting, making sure you touched on the subjects, if they brought up anything that is important or of consequence that I should follow up with, and then just the general outcome of the meeting. Were they supportive? Do they sound supportive? Do they say, you know, I want to help you, I want to help the community, what can I do to help you out? And this is a good time for me, you know, tying back into advocacy being 365 days, is I get all of these forms, I go through, I break them down, and I can say, you know, Senator Smith from Minnesota, her office indicated she wants to do a lot more work in this space. So then I know to follow up with her health staffer and say, you know, it was great that you had an opportunity to connect with our advocates. Here's how the senator could be more helpful. You will also see that not everybody has a full afternoon. It depends on the timing of your meetings and how many folks are in your group. Some folks may be done earlier on in the afternoon at 3 or so. Some may not be done until, you know, 4 o'clock. I will be in the Dunkin' Donuts waiting for folks. I will be there early in the afternoon. You know, I'm putting the schedule together so I know exactly when the when folks' day ends. But if you are running late because you have to catch a flight or catch a train, you can just send up your follow forms later. You could send them in to Janet or to me, and, you know, we'll get those. But it's just a good way to, you know, come back and say, Phil, this is what we talked about. This was a great experience. Or if you come back and say, you know, this is some difficulty we had, it's a good way for us to assess the day.
Great, thanks, Phil. So just a quick look at the schedule for Tuesday and Wednesday. All of the meetings and events on Tuesday will take place at the Westin Washington, D.C. City Center, where if you requested a hotel room, that you have been housed there, and by now you would have received an email with your confirmation number. There will be a registration table outside the National Ballroom, AB, like Apple and Balloon, where all of our meetings will take place on Tuesday afternoon. You can pick up your name tag and the materials that Phil has been working on. We'll have a bag for you. That will start at 2 o'clock. We encourage you to have a bite to eat before that. We will have coffee and sodas available at 2, and then we'll break at 3:30, and there'll be some light refreshments served. And then at 4 o'clock, all of the advocates will join us. So the 2 p.m. session is designed to provide an overview for new advocates or advocates who haven't participated in a while or who just want to be present, an overview of sort of how Washington works and what to expect in a meeting. But 4 o'clock, everybody will be together, and that's when we'll review all of the materials that were sent yesterday, what the leave behind is, and really what we're asking for during these meetings. So we call that our legislative briefing. And there's an opportunity to talk with both Phil and Dale Dirks, who both of whom will be there with us all of Tuesday afternoon, and to meet other members of your team. So that legislative briefing will go from 4 to 5, 5:15, 5:30, and then we'll take a break. And you're encouraged to meet with your team members, go through the schedule. You'll want to make sure you identify who is the lead person for each of those meetings, because we want that office to hear from the person who is the constituent, so they would take the lead on that meeting, and it's a nice opportunity to go through your schedule and actually write in on every meeting who's the lead person, who's gonna take the minutes or the little notes that the follow-up notes for that meeting. Or check into the hotel, or maybe you just need a break. Maybe you just need to put your feet up for a little while. So there's a little bit of time to do that. Dinner is at 6:30. It'll be in the National Ballroom C. We will seat everybody together by teams. So if you didn't get a chance to meet everybody on your team or to meet anyone on your team Tuesday afternoon, you'll certainly have that opportunity during dinner that evening. Then everybody goes to bed, has a good night's sleep. Wednesday morning, we will have a full breakfast, and we will once again have the opportunity to ask any questions. Dale or Phil or both will be there to respond to questions. As Phil's already noted, there are always last-minute changes to these schedules. We'll announce those if we have them at that point, and we'll work closely again with your team captain to keep your team apprised of any changes to your schedule. Everybody starts at a different time. Some people may be starting at 9, others may not have their first meeting until 11 o'clock. You know, the times are just working out for whatever your team is and however those meetings have been scheduled. So when it's time for you to go to the Hill, we'll load everybody in cabs. Cabs will be available, and you go to the building where your first meeting is going to be. So that sort of takes us through Wednesday. Phil talked a little bit about the briefing. If you're running late and you can't make it, don't worry about that. If you're traveling on Wednesday, you're returning home, you can leave your luggage at the hotel. They have a place to store it. They'll give you a luggage tag. You come back to the hotel after all of your activities on the Hill, retrieve your luggage, and then you can take a cab or the metro to whatever airport you're leaving from. The weather right now is predicted to be in the mid-40s on Tuesday and the mid-50s on Wednesday, but with some rain in the forecast right now for Wednesday. But that'll change. That may change. So just check the weather. Feel free to bring umbrellas, raincoats, those kinds of things. So that's our schedule for Tuesday and Wednesday together. I think now we'll go to some questions that we've been sent. One of the first questions, Phil, I'm going to give to you, and it really has to deal with sort of the tone in Washington. I know you and Dale will cover this on Tuesday afternoon, but given sort of the polarization that we hear about in the news, would you expect that we'll be well received and you know, our advocates will have the opportunity to present what we're asking for to anybody, whether they're a Democrat or a Republican?
Thanks, Janet. Yes, while it may seem like dysfunction is at an all-time high here in Washington, and admittingly it is dysfunctional here in Washington, but the good part of the work that we do is, you know, the importance of dystonia and our ask not being partisan is we don't get swept up into a lot of these incredibly politically charged conversations. I know advocates who are of one political party, but they're members of another, and they may not agree on a lot of things, but on this, you know, their member is there for them. And you have, you know, some very strong conservatives who are supportive of dystonia, RS in the community, and then you have, you know, ultra liberals who are very far left who support this as well. Without getting too much into the issues, you know, our biggest ask is for support for the National Institutes of Health and for the Department of Defense Peer Review Medical Research Program. You know, we haven't had an instance where we've gone into an office and that member has said, I don't support NIH funding. Or you know, there has been some, not opposition, but some vocalizing of not having research at DOD, but we've seen Congress consistently committed to these programs. We've seen Congress in the past few years drastically increasing funding for the National Institutes of Health, increasing funding for the Peer Review Medical Research Program. So a lot of the conversations we're going to have and a lot of the members that we're going to see, you know, they may not agree on a lot of things, but they're not opposed to the things that we're asking for. And coming from a constituent, you know, this isn't something that, again, like I mentioned before, doesn't care if you're a Republican or a Democrat or if you're from New York or Alabama. you know, when you go into these offices, you're a constituent of this member, and you know that means a world to them that you're here.
Thank you. There was a question about when you mentioned that going through security, cell phones would have to be taken out, you know, removed from your person, and the person wants to know whether or not they should leave their cell phone at home. And I think the answer to that is no. Bring your cell phone with you, because you may need to be in contact with people. Again, you may want to take photos if your phone has that capacity. It's just going through security like you would in the airport. You need to take out your keys and your wallet and you know, your phone and put them in the little bowls, and they go through the scanner. So not to worry, you don't have to leave it at the hotel. You should really plan to bring it with you. So.
Yeah, and I encourage everybody to bring your phone with you. And one of the things we'll talk about on Tuesday is, and it's important that we have everybody with their teammates, is to share your contact information. There may be an opportunity that comes up, you know, going back to being flexible, where you're scheduled to meet at 10 o'clock, but the staffer comes out and says, I'm so sorry, I just got pulled into something. Can you come back at 10:30? You know, let's say you're going to Senator Schumer's office, you're from New York, but you're with another state, let's say New Jersey, just as an example. And you have a New York meeting at 10 o'clock and a New Jersey meeting at 10:30, and your New York office says, I'm sorry, I just got pulled into something. Can you guys come back in a half hour? You know, the answer to that would be yes, and the team would split up, with the Jersey folks going to the Jersey meeting and the New Yorkers staying in the New York office. And it's important for you to be able to communicate, you know, after the meeting is over, where do you meet up to continue your day? It's just good to have in case something does come up. And as Janet mentioned, if you have the photo capability on your phone, it's good to have it with you. You know, we've bumped into numerous members while they're moving around through the tunnels, and it's a good opportunity to stop, say hello to them, and get a quick picture.
Yeah. So you want to, while you're moving from building to building, keep your eyes open, because you never know who you're going to see, and that makes it sort of fun. There was a question, Phil, about that I'm going to ask you to respond to, and it's about, and it's a little bit of a policy issue that I know we'll address on Tuesday, but are we not asking for pre-existing conditions with insurance to be preserved?
Yes.
Yeah, go ahead.
We will be discussing that, but the reality is, with the Democrats being the majority party in the House, it's not the same political climate that we had over our last few Dan Hill days, where with Republicans in the House and the Senate, you know, trying to figure out a way to repeal and replace the Affordable Care Act. It's something that we will still mention, and it's something to still include as part of your story, but it isn't something that is it's not something that we anticipate happening with Democrats being in control of the House. We don't see them doing anything that would undermine it. In fact, they have gone to great lengths to reaffirm their support for protecting individuals with pre-existing conditions. It's something that they ran on in the midterms. It's something that they believe politically that is they're on the right side when it comes to it. We don't anticipate any changes to that.
Great. Someone has asked if we can provide sort of a template paragraph that would go with any photo that's taken for either posting on social media or use with local newspapers, and we're happy to do that. So you can look for that to happen following Advocacy Day. Another question for you, Phil, who are in and out of these buildings on a regular basis. Can we bring backpacks in or briefcases? What's the limit on what we can bring in through security to enter the buildings?
Sure. So I would not bring your luggage with you for the day. Give an example of something that I think is too large, but if you do have a backpack that if you're the team leader and you want to have that for all your folders, or if it's easier for you to carry around a small briefcase or a small bag, everybody will also get a Dystonia Advocacy Network bag that will have your folder in it, and that you're going to be able to carry around on Wednesday with you. I think that bag is big enough for what you would need. But I know some other people, ladies, for your purses or your pocketbooks, those are good to have as well. It won't give you any issues with that in terms of coming through. Again, you just have to put it through security, and that's it. And you'll be able to walk around with it.
Great. And also no liquids, right? Like going through the airport security?
So if you have, the only opportunity that they would use to take that away is if you wanted to go into the Capitol itself. But to go into the Senate building, if you want, you're coming from the hotel in the morning and you want to have a bottle of water with you for the day, you can do that. If you're at lunch and you get a bottle of soda and you're leaving the Senate side and you're walking outside over to the House side, you can bring that through. It's just if you're going into the Capitol itself, they will throw that out. But we don't go through the Capitol because there's just so many of us.
Okay, great. Someone's asked how many advocates we expect next week. Right now we have about 95, but we did have a couple of cancellations this morning due to just a number of extenuating circumstances. Somebody had a death in the family. Somebody had an accident over the weekend. So I expect we'll be right around 90. So very, very good turnout, which speaks just volumes about the commitment of the dystonia community in wanting to make life better for those who are affected by dystonia. So again, thank you to everybody. A question about the size of the teams. Phil, do you want to address sort of how the teams are put together and generally speaking, how many people are on a team?
Sure. I try every year my very best to give a good geographic balance to our teams. I very rarely will I put a New York and California together because there's less that brings them together than having a New York and New Jersey team, for example, or having a Midwest team. I find it easier to have, for example, Florida and Georgia together since they are two states that are connected. The team breakdown just depends on how many advocates we have from a specific state. For example, we have a lot of DC advocates this year, but I don't have a specific DC team because of the pure fact they don't have any senators and they just have a non-voting representative of Congress. So they're part of another team which has senators. That way they could see some Senate offices. But states like New York and New Jersey and California have a large enough number of attendees where they're just seeing their own state. So it depends. Some states we have folks coming from, it's just one of them. But we've paired them up with other states. It really just depends on the pure number. I try not to go over more than 8 in a group. That's usually the absolute maximum. But I try to stay between, 5 and 7. But even 7 is pushing it, unless there's, a very active state such as Maryland. There are always a lot of folks from Maryland. So they're always their own team.
Right. Thank you. And again, this I think speaks to wanting to, talk with your teammates, get to know where everyone's from. Because if you're, as Phil said, you may be meeting in the hallway, you might be meeting in the cafeteria, and maybe if your team is on the larger side, you might decide that those who are not constituents of that particular member of Congress, maybe you hold back so that the number is smaller. That's the kind of rhythm you'll figure out with your team, I think, on Tuesday and Wednesday. So one question that I think is probably on the minds of everybody is, can we expect to actually meet with members next week?
There are some folks who, at least on the Senate side, a lot of Senate offices have what they call constituent coffees, where they have in the morning from about 9 to 10 or so. The senator will be there, the staff will be there to meet with folks who are here from that state. Those are limited, however, only to members from that state. I know for a fact that our folks from New Mexico will be seeing Senator Tom Udall's office at his coffee, but it's just for the folks from New Mexico. Senator Young from Indiana is also hosting one. It's just for folks from Indiana. So we don't have, aside from those kind of coffees, we don't have specific member level meetings. But it's not out of the ordinary if you're in an office and the member is either coming back to the office or heading out somewhere, that he or she may pop in and say hello briefly for a few minutes.
Yeah, great. Thank you. Well, these have been great questions, and again, we appreciate you, all of you, taking the time to spend with us this afternoon, and we're very much looking forward to a wonderful, wonderfully successful program next week. So we wish you safe travels, and we look forward to seeing everyone on Tuesday afternoon. Thank you again for participating, and thank you for being a dystonia advocate. Goodbye.